Welcome back, everyone. This is our last lecture for the semester, and today we're going to focus on over-the-counter or OTC drugs and prescription drugs. This might be one of the more straightforward discussions that we've had this semester, as you should be the most familiar with these types of drugs and medications in comparison to things like many of the illicit and harder substances that we explored earlier in the semester. So let's go ahead and get started talking about all of the stuff we need to cover today. When we're talking about prescription and OTC drugs, we're really talking about whether or not there is a physician involved to oversee the use of these medications. Prescription drugs can fall anywhere between Schedule 2 and Schedule 4, but OTC drugs fall into the Schedule 5 category only. So if you remember earlier in the semester when we discussed drug scheduling, we stated that drugs are scheduled based on their medical recognition and based on their potential for abuse. So doctors can prescribe Schedule 2 drugs like morphine and oxycodone for pain purposes, just like they can prescribe Schedule 4 drugs like Xanax for anxiety issues. All prescription drugs must have a prescription issued from a licensed physician so that they can be later dispensed by a pharmacist. Schedule 5 drugs do not need a prescription or a doctor's approval, but they can be monitored and do have the potential possibility of creating complications with other medications. Some of these OTC medications can be quite strong. Think about things like Delsum cough medicine or NyQuil. Those can put you to sleep. If you're already taking a medication that makes you drowsy, these can compound the issue and make your drowsiness worse than you originally intended. They can also be regulated by the state. Think about things like pseudoephedrine and how the pharmacist needs to swipe your driver's license at Walgreens if you want to buy something like Claritin D. They're monitoring and regulating the amount of pseudoephedrine that you can purchase so you don't start cooking methamphetamine in your kitchen. As you may remember from earlier in the semester, individuals' perceptions about doctors and medicine were not as positive as they are today. Today we accept that doctors know what they're doing and that their prescription recommendations will be effective. However, that thought process didn't really pick up until the Durham-Humphrey Amendment was passed in 1951, and the government was able to make changes to the structure of pharmaceutical drugs. Think about where you last heard about this amendment, as we have previously talked about it this semester. As a refresher, the Durham-Humphrey Amendment was passed due to government concerns regarding habit-forming drugs and the continued use of patent medicines, which were created and used without any sort of regulation. Before this, the only thing that needed to be done was to include the ingredients on the labels. But how many people would actually read those when somebody was spouting off about the wonders of this newly created patent medicine and how great it would be to cure whatever it was that ailed you? As the labels were only required to list the ingredients of the medicine, the next step was to make the distinction between those drugs that needed more supervision and those that did not. The two general categories were born of the new amendment, and for the most part, OTC drugs were considered safer than prescription drugs, and therefore need less supervision from a doctor. But some of these drugs do have the potential to cause some of the harms for the user that we stated earlier in the lecture. We use a lot of OTC drugs, and since there is no regulation on a lot of them, we are doing a lot of self-medication. There is a variety of options that are out there for us. Whatever ailment you have, there is an option to treat it. If you have something wrong with you, you can walk into any pharmacy and buy a variety of medications to try and treat your symptoms without ever having to go to a doctor's office. Got a headache? Try one of these 19 different types of pain relievers. We use more OTC drugs than we do prescription drugs percent-wise. More than half of all medications purchased are OTC drugs in comparison to prescription drugs. Why do you think that is? Well, really, the most logical explanation is that not everyone has insurance, not everyone goes to a doctor on a regular basis, and not everybody can afford prescriptions. OTC drugs are often much cheaper if you do not have insurance. So we try and treat it ourselves, and we're spending $18 billion annually trying to do it. But even though we take more of them a year, that's fine because they're generally safer per dose than prescription medications. The margin of safety for these drugs is really large. As another refresher, what do we mean by the margin of safety? It's the general area between dose and overdose. It would take you a lot of one of these medications and a very long time before you actually OD'd on some of these drugs. Some of these drugs actually, it might be physically impossible for you to actually overdose. Have you ever heard of someone ODing on NyQuil by just using NyQuil alone, no other combinations? Nope, you might get one hell of a tummy ache, but no ODing for you there. But what about the physical and psychological dependence? Is that possible? For all drugs, just prescription? What about OTC drugs? It's less likely that you would develop a strong physical and psychological dependence on OTC drugs, but it is possible at some level. If you can become physically and psychologically dependent on coffee as you're looking for your caffeine fix, then it's possible that you might experience a low-level dependence, at least on a psychological level, on some OTC medications. Think about the sleep aid I have pictured on this screen. If you're taking a Tylenol PM every night before you go to bed because you think it helps you sleep, and then suddenly one night you don't have a Tylenol PM to take, you might not be able to sleep because you think you need the pill to help you. But really, there's so little active ingredient in one tiny Tylenol that this inability to sleep is really just a mental game that you're playing with yourself. You think you need the pill, meaning there's a low-level psychological dependence occurring, but your body is capable of sleeping without the medication for sure. Is it the same type of dependence that heroin would produce? Certainly not, but it might be there on some levels for some people. Those individuals who are likely to abuse over-the-counter drugs are not the same people who are abusing illicit drugs. But having habit-forming behaviors for OTC drugs are not the same as they are for other types of medications. If you begin habitually taking Tums to cure your chronic heartburn, what do you think is going to happen? Well, you might actually cure some of your heartburn, but the biggest danger associated with Tums is the formation of kidney stones. Tums are nearly pure calcium, and taking that many will likely result in calcium deposits, which may result in kidney stones. So the dangers of OTC drug abuse are less severe, but no one wants to get kidney stones, so maybe it's time to go see a doctor and get some Nexium for that heartburn. The Durham-Humphrey Amendment to the Food and Drug Act required that certain drugs needed a prescription and that others did not. So now we have the first formalized mention of OTC drugs, even though people had really been buying OTC drugs for years. So this new law categorized drugs based on dependency issues, whether or not it was habit forming, if it should be supervised by a doctor, meaning it's not safe for self-medication, or if it was brand new, then it would be considered a prescription drug. This law also allowed for the refill of prescription medication for the very first time ever. Many new drugs still fall into this categorization. If it is new, then they require a prescription unless it was specifically designed to be an over-the-counter drug. As we mentioned on the previous slide, Nexium will help you relieve the heartburn you've been experiencing without getting those nasty kidney stones. For many years, the purple pill was only available via prescription, meaning that you had to go see your doctor, discuss your heartburn, maybe get an endoscopy, see what's going on, and then go home with your Nexium. But within the last handful of years, Nexium has become widely available as an over-the-counter drug. It's not the same strength as the prescription version, but it is now available without a prescription. So how does that happen? Well, according to the FDA's switching policy, after so many years of being sold as a prescription strength drug, and if the drug can be shown as successful in treating what it was originally meant to treat, then the pharmaceutical company can sell it as an over-the-counter drug if they change the formula somewhat and don't make it prescription strength. But the FDA must first approve the switch from the prescription to the over-the-counter version. This is considered a prescription to OTC switch. After 3 years of prescription status, a pharmaceutical company can then apply for an OTC status. Many drug companies choose to change the strength of the drug and have a prescription version of it in addition to their OTC version. That way they can make twice as many profits. It also has to be a very popular drug, like Nexium is. If they choose to alter the product's formula or strength, the FDA must approve that switch as well. In addition, they also require some more testing depending on what the switch or the change is. There also can't be a large chance for drug interactions to occur. The doses on a lot of these OTC drugs aren't very high, so they don't really cause severe drug interactions, but there is still some concern. So one of the biggest ones that most people, specifically men in this case, are hopeful will make a switch to an over-the-counter version is Viagra. Considered the life-saving little blue pill, it will most likely never be switched to an over-the-counter version due to the amount of risk that is involved with self-medication. Viagra is often used by those men who are a little bit older and who are having some blood flow issues. But when you're older, then you generally are on more medications than younger men, many of which might deal with blood pressure, heart conditions, or blood clot conditions, and therefore Viagra might not be safe for certain individuals to use without doctor consent and approval. It doesn't mean that they're not able to use Viagra, but that the original medications may need some tweaking to account for the introduction of the new drug, so that there are no medication interactions occurring. If this were an over-the-counter drug, we would have a lot of heart patients having a real good time, but are on the verge of blowing their hearts out. The good thing about OTC drugs is that they can often successfully treat an illness or help mitigate the symptoms of an illness without doctor interference. As there is no cure for the common cold, and many of us simply have to tough it out, taking a cough medication and a decongestant is probably about the best that we're going to get. That doesn't necessarily mean that I need to make a visit to the doctor's office unless my symptoms get worse. However, how many of us are actually following the dose recommendations on these over-the-counter drugs? If I'm coughing up a storm, am I taking the time to measure out the proper amount of NyQuil out in that little cup that the company provides? Or am I just taking a swig out of the bottle and calling it a day? My headache isn't gone, so I'm going to pop 2 more Tylenol. I can't sleep, I'm going to pop 2 Tylenol PM, or I'm going to take some of that NyQuil even if I'm not sick. I might not have a headache or a cold, but I take them anyway. What's the problem with this? When it comes time to treat the headache or the cough, these medications might not work as well, and you need to take a bigger dose because you're becoming more tolerant to them. So many people have been using NyQuil to simply sleep, even when they're not sick, that the company actually had to come out with ZzzQuil. It's just a sleep aid, and if you think about it, if they had to come up with this whole separate product just to help us go to sleep, a lot of people had to be taking a swig out of that NyQuil bottle and calling it a day to go rest. As we move forward in our lecture, we're going to be turning our attention to prescription drugs. This is a really big industry, and for many of us, a very expensive aspect to our lives. So we're using a lot of prescription drugs, and there is something to treat everything at this point. Have a rash? Use this cream. Have an earache? Try these drops. Have high blood pressure or high cholesterol? Well, we have something that will help bring both of those things down for you. At this point, we have roughly 10,000 different prescription products, but that accounts for only about 1,500 different drugs. So how does that work? Think about it. You have all kinds of different doses for each medication. Remember when we were talking about things or drugs like Xanax? There were 4 different prescription strengths that we mentioned for Xanax alone, and that's just one drug. Then you have a generic version of the same drug, and they all come in different doses as well. That's a lot of redundancy, but it helps keep the pharmaceutical companies in business and raking in the money. In 2009 alone, we spent more than $300 billion compared to the $18 billion for over-the-counter drugs. Sometimes our insurance covers the majority of that cost for us, but depending on the drug, it might not cover anything at all. So just as I mentioned, most medications have both generic and proprietary versions of the same drug. Generic drugs are things like acetaminophen, as you see on the left side of this picture showing 2 bottles. The Equate version on the left is the Walmart brand, but everybody has their own version of acetaminophen. It's a generic form of the drug. However, you cannot market your Equate acetaminophen as Excedrin or as Tylenol, as that is a brand name that is registered with the patent office. So it's the proprietary version of the same drug. You can market it as generic acetaminophen though. That's how you get around the patent. Remember, as we stated earlier, that the Durham-Humphrey Amendment to the Food and Drug Act required that certain drugs needed a prescription and that others did not. So this law categorized drugs based on dependency issues. If it was habit forming, if it should be supervised by a doctor, or if it was brand new, then it would be considered a prescription drug. This law also allowed for the refill of prescription medications for the very first time ever. So now you don't have to go back to the doctor every month to get a brand new prescription every time your pill bottle is empty. Many new drugs still fall into this categorization. If it is new, then they require a prescription unless it was designed specifically as an over-the-counter drug. However, it still needs FDA approval before it is sold. Drug abuse is always a big concern given the number of prescriptions that are floating around every year. Obviously, our biggest concern is the amount of prescription painkillers that we prescribe annually. Many of them are habit-forming and have dependence concerns. $70 billion a year is spent on painkillers alone. That's nearly 1/4 of our yearly spending for prescription drugs overall. That's a lot of money for one specific type of drug. And these things are strong, so dependence is always a questionable concern. In terms of abuse, we are really concerned about the abuse of opioid painkillers in particular. People are selling them on the black market and they try to make a profit that way. But one of the biggest concerns that we're recently have been facing is not necessarily just the abuse of these specific types of drugs, but the increased reliance on stronger opioid drugs when the prescription opioids stop working or when the effect is diminished. As we talked about earlier in the semester when we covered the opioid drug group, many heroin users originated as prescription opioid users. At some point, when the pain that was being treated was no longer being treated effectively by the prescription, and there was no stronger pill option that they could take, some have transitioned into illicit opioid use, most commonly heroin. And as we know, heroin overdoses are all over the news right now. Many people who use heroin don't know how to use it effectively. And there is a very thin margin of safety for injectable drugs like heroin, and many users end up overdosing from either the drug itself or from improper injections. Like with all intravenous drug use, you have to make sure that there is no air in the syringe. You have to clear the line, or the air bubble that gets injected into the vein can very quickly kill you. In addition, the official use for these drugs, people are also using prescription drugs to supplement other behaviors and symptoms associated with the illicit drug use that they are already engaging in. For instance, they may need help with withdrawal. Remember that when people are withdrawing from things like heroin, they may need to go on methadone to help with the withdrawal process so they don't die from the lack of heroin that is being expelled from their bodies. They may need antibiotics to help treat infections that may come from the use of intravenous drugs. As an injection site gets infected, it needs to be treated. But why would one tiny injection site become infected in the first place? The most common cause is using dirty needles. Many states in this country do not provide clean needles to dependent people, so they often have to resort to sharing needles or reusing old needles, which provides a variety of different issues down the line when the user comes to the hospital with bigger complications and no insurance to treat these new symptoms, as we talked about earlier in this semester. All right, so just a few more things as we close out our very last lecture of the semester. Once again, we turn our attention to our old friend John Oliver for a few words of wisdom on the pharmaceutical industry and how pharmaceutical representatives are trying to market to doctors. There's a lot of money available for pharmaceutical reps to make if they can pander successfully to doctors to get them to prescribe a certain medication that their company produces. However, as Oliver discusses, sometimes these representatives go way too far and start giving doctors money, trips, free meals, rounds of golf, and other perks just to get them to prescribe these medications. So go on the class website and watch the video that I have posted there. It's about 17 minutes long, and once again, as always, this is an HBO show, so the normal disclaimers about language and crude humor may apply. So I hope you enjoy. And the very last thing I want to talk to you about today is Daraprim. This is a drug that treats toxoplasmosis. This is not an HIV/AIDS treatment pill. However, toxoplasmosis is a parasitic infection that mainly threatens people with weak immune systems, such as HIV/AIDS patients, organ transplant patients, and some pregnant women, but it can kill their baby, so it's not a recommended drug for pregnant women to take. The reason that I want to talk about Daraprim is not because of the drug itself. It's because of this guy. This is a picture of Martin Shkreli, the former CEO of Turing Pharmaceuticals, who thought it would be an excellent idea to raise the price of Daraprim in 2015. Some of you may remember this story from the news. As we have an open and free trade market, Mr. Shkreli is legally able to raise the price of his drug that his company produces. However, he thought that there wasn't enough profit being made from the drug at the current price given the amount of patients that took the drug. And since the number of patients who took the drug was considered low, at least in his eyes, he decided he was going to raise the price of the drug exponentially. Shkreli decided to increase the price of the drug from $13.50 per pill, which is already pretty high, to $750 per pill. For the average user of this medication, a person on a 75 milligram dose rose to about $75,000 a month just to be able to take this medication, with the increase from the $13.50 per tablet to $75 per tablet. As Turing is the only manufacturer in the United States of this medication, patients cannot find a generic version of the med, nor can they purchase any alternative versions in the United States. Shkreli actually had the nerve to then go on and defend his behavior by saying, quote, "If there was a company that was selling an Aston Martin at the price of a bicycle, we would buy that company and we would ask to charge Toyota prices. I don't think that should be a crime," end quote. As a result of the backlash he faced, Shkreli hired a crisis public relations firm to help explain why his company decided to make this move and increase this price. Turing Pharmaceuticals announced that on November 24th, 2015, that, quote, "it would not reduce the list price of the drug after all," end quote, but they will offer various patient assistance programs. The price increase has been fiercely criticized by physician groups such as HIV Medicine Associates and the Infectious Disease Society of America. In India, a pharmaceutical company manufactures a near identical version of the same medication and charges, get this, between 4 and 10 cents American dollars per pill. In the UK, it's about 66 cents per pill, and in Brazil, the same pill costs about 2 cents American dollars. And because all good things come to those who go looking for them, Shkreli was fired from Turing Pharmaceuticals by the board of directors at the end of 2015, almost a month after they made the decision not to lower the price of the pill. He was fired at the end of 2015 after he was arrested by the FBI on charges of securities fraud. Good for him. He was accused of running a Ponzi-like scheme, and in 2017 he faces a criminal trial to face those allegations. And it could not have happened to a nicer guy, if you ask me. Alright, so as we wrap up this semester, I just want to leave you with the idea that drug use is a very complex issue, and it is not just a black and white one anymore. Over the years, opinions on drug use, whether they be illicit or licit in nature, have seen some shifts. We trust doctors more than we ever have in the past. There's a variety of medications out there that can save our lives when we used to die from diseases that we didn't need to die from. Childhood vaccinations save lives and prevent diseases like polio that used to be totally debilitating. But it wasn't always this way. We didn't always trust our doctors because they often didn't have the technologies available to treat us like they do today. But even still, there is a portion of society that chooses to self-medicate and treat their symptoms on their own. That is not always a bad thing, but when the symptoms need prescription treatment, science has provided us with some pretty amazing cures. As I close, I just want to say thank you all for a very great semester. I love teaching this class, and I hope you all enjoyed it as well. Thank you again, and I hope you have a great break. I'll see you guys soon. Bye.